any queries you might have. We introduce our senior consultant, Dr. Raghavan, who is specialized in urology, uro-oncologist, and robotic surgeon. So, today we are going to see a topic around prostate problems. So, around 25% of men aged 55 years and over have a prostate condition. This increased to 50% by age of 70 years. If you are a man and you are in your 50s or 60s, talk to a doctor about whether you need to have your prostate gland checked, and if so, how often. If you have a family history of prostate disease or if you have a particular concern, talk to our doctor early about when prostate checks might be suitable for you. So here are a few questions for you, doctor. So what are the different types of prostate problem?
So prostate problem depends upon the age of the patient. So if you have a young man, like in the age group between 20 and 40, they may have a condition called chronic prostatitis, which is a mild inflammation affecting the prostate and is very common in IT professionals who are sitting for a long time. As we grow older, the prostate enlarges, or more than enlargement, becomes tighter and doesn't allow the flow to happen. This is called benign, that is non-cancerous enlargement of the prostate. And also the third important condition is the cancer of the prostate itself, which happens usually in men above 50, more common in men above 60. The incidence of prostate cancer is definitely higher, is getting high by day, and therefore one has to be aware of prostate cancer as a clinical condition that needs attention.
So what is a common one, and why does it happen, sir? Is there any types in it, doctor?
You're asking about cancer or
common problem, prostate problems.
The most important cause of prostate problem is age. We being born as a man means that we have a prostate, and when we are born as a man and we grow older, the prostate also changes its structure, and the presence of the prostate and aging are the two important reasons why anybody develops a problem in the prostate. All right. Now, in individual clinical condition may have individual problem and reasons behind it.
So how do we diagnose for prostate problem, doctor?
Patient will have symptoms. In most of the time, patient will come and say, "Doctor, I'm having difficulty in passing urine. My urine stream is slow. I'm taking a long time to completely empty, and I'm standing there for a long time when my friends come and go, and the stream itself is very slow." This is one set of complaints. We call it voiding or difficulty in the flow. The other is called storage symptoms. "Doctor, I'm going often to pass urine. I'm going urgently, and if I can't go, I leak urine." So those are called storage symptom. In men, many times storage symptoms is a secondary effect to the blockage itself. In women, the storage is an independent problem to blockage, because women don't have a prostate problem at all. So the symptoms are the most common thing that you find in these men.
When should they start testing for the prostate cancer, doctor?
Generally, if you don't have a family history of cancer, then you can test it from 50 and above. If you have a family history of prostate cancer, 40 and above.
So what are the different types of prostate cancer?
The most common cancer is called adenocarcinoma prostate, which is present worldwide. Then there are some super rare cancers in prostate. Prostate itself can happen. Those are very, very rare. People don't need to worry about it. The most important thing they need to be concerned is the adenocarcinoma prostate, which is the most commonest cancer.
What are the warning signs for this, doctor?
Keep in mind, many cancers, not only just prostate, any cancer, the early stage have no warning signs. They are called asymptomatic patients. Patients don't have a problem. When you test them, you find that they have cancer. This is very common, not only in prostate, in breast, in kidneys, many organs have this presentation. Now, beyond that, as I described before, the urinary symptoms might be a precursor for the cancer, as in the symptoms patient, when you test them, they may have a concomitant cancer as well. So two things I want to emphasize: one, many of the early cancers have no symptoms, and therefore be aware and test yourself. Secondly, when you have a symptom, do go and check out whether you have a cancer or not.
So when we look into prostate enlargement, what would be the main cause, doctor, for the prostate
Main
enlargement?
cause of prostate enlargement, as I described before, is aging.
What is the latest treatment for enlarged prostate?
Enlarged prostate itself doesn't warrant a treatment. Please keep in mind, enlarged prostate can happen for every man above 50. As you started in the introduction, not every man will develop a prostate problem. So enlarged prostate doesn't mean that you have a problem. So, but on that same token, if you have an enlarged prostate and you have a problem, then you need treatment.
So what is the latest treatment for the enlarged prostate?
Um, the first thing I would recommend that we can give tablets to reduce the enlargement. After that, we can do an operation. Then there is something called prostatic artery embolization, where we put a little dye into the blood supply to the prostate and put a blockage there, and therefore the prostate shrinks down. So these are the latest developments in terms of prostate enlargement. This is non-cancerous enlargement.
So they can shrink the prostate without the surgery, doctor.
Yeah, they can, and that's called prostate artery embolization.
So what is the safest medication for the enlarged prostate, doctor?
There's a tablet called dutasteride or finasteride, which primarily reduces or shrinks the prostate down. It is widely available but should be taken always under a medical supervision.
So at what size of the prostate they requires a surgery?
There is no definitions for that. You can have the smallest prostate of 20 cc still requiring an operation. You may have the biggest prostate of 200 cc still not requiring operation. So the requirement of an operation or not is based on the patient's symptoms, not just the size of the prostate.
So what is an alarming PSA level, doctor?
Once again, it all depends on the patient's age. For example, if somebody is in the 50, a value of 2.5 and above is important. Somebody at the age of 60, 3.5 and above 70 is 6 and above. So it's called age-related PSA. It changes with the age.
So if the enlarged prostate is left untreated, what will happen?
As long as enlarged prostate doesn't have problems with the flow and doesn't have problems with cancer, it can be left untreated. So enlargement of prostate, as I keep insisting, is not a disease. It is something that every man has to face. But if that enlargement prostate causes a blockage in the flow or develops into a cancer, then they need treatment.
So the enlargement prostate can come back to a normal, doctor?
If my hair, which has become gray, becomes black again, then it can.
Can prostate affect the bowel movements, doctor?
If the prostate is very large and it is not allowing the urine flow to happen and the urine stays back in the bladder a lot, then those patients will feel a bit constipated as well. Though there is no direct effect, there's an indirect effect on that.
Can they live without a prostate, doctor?
Women live without prostates. Men cannot live without prostate. If you lose your prostate, then you cannot have the ability to produce a child.
Why does the prostate enlargement at night, doctor?
Prostate doesn't enlarge in the night. It enlarges over a long period of time. What happens in the night is that the change in the way the bladder functions will make the patient go and pass urine often to the restroom, and therefore we think prostate is enlarging in the night. It is not the case. Prostate enlargement happens over a long period of time. The symptoms are more profound in the night. That's all.
So what is the success rate of the prostate surgery?
For cancer, the success rate is super high. You're talking about 90s and 95% success and beyond. For non-cancer, once again, the success is phenomenal. The non-cancer operations is based on the fact that the patient is not able to pass urine, and hence they need an operation. And if they do an operation, they do very, very well.
So what is the least invasive prostate surgery, doctor?
least invasive prostate surgery for a benign, that is non-cancerous enlargement, is to do something called a camera X test. Like endoscope, you do a cystoscopy, and from there you do a TRP operation for that. For cancerous enlargement, the most minimally invasive surgery is called robotic surgery, robotic radical prostatectomy.
So can walking shrink enlarged prostate, doctor?
Walking will make you healthy, but will not shrink the prostate. No.
Uh, is there anything specific they have to avoid during the enlarged prostate, doctor?
There is nothing specific you can avoid in the enlargement prostate. It's just something which happens with everybody who gets older.
So this surgery is not serious.
No, it's not serious.
Can they still get an erection if prostate is removed?
The benign enlargement of the prostate, where you put a camera and deal with the blockage, will not have major impact on the erections. But cancerous enlargement requires a radical prostatectomy as a treatment. Those patients, the erections will get affected, and therefore they will lose erections. And then we have to help them by other methods. There are other methods by which we can support these patients to get the erections back.
So, do they need a bag after the prostate removal?
For 7 days, patients will have a catheter with the bag, but after that, the catheter gets removed and there is no bag after that.
So, if they get admitted for the prostate surgery, how much days would be the recovery time?
Many small prostates require, many benign prostates can be done as a day case operation. In Apollo hospitals, we do even cancer enlargement, robotic radical prostatectomy as a day case. So majority of the patients come in the morning, go in the night.
So regarding food, is coffee good for?
Coffee is always good for me. I like coffee, but having said that, there is no direct impact on prostate and coffee and prostate. There has been a lot of studies looking at green tea helping prostates and this, that, and all. None of them have been very strong scientifically. So my personal view is that coffee is not harmful.
So in the, what food, is there any food which make prostate enlargement worsen? Something like that, doctor?
Not to my knowledge.
Okay. So in general, what would your information to the viewers who is looking?
My information to the viewers: don't get panicked on the prostate. Prostate is something all of us are born with. All men have prostates. It's not a sin to have prostates. It's like breast for women. It is just part and parcel of women's body. That's absolutely fine. What we should be is, like women, being breast aware and therefore go for periodic checkup for the breast conditions. Men should have a periodic checkup for prostate conditions. And what you should do is first be aware, don't panic. If you have urinary symptoms, reach out to a doctor and check it out. If you don't have a urinary symptoms and you're above 40, do a PSA checkup to make sure we're not missing a cancer. And then do a health checkup every year or every 2 or 3 years in order to make sure that we're not missing something. And if you get diagnosed with a cancer, please don't panic, because the treatment for prostate cancer is wide and extremely good treatment is available, and patients can live absolutely normal life. 90-95% of the patients can get cured of the cancer as well. So it is a very hopeful situation. Don't panic. All you need to do is just be aware.
So can you share us any of the prostate patients, the patient who underwent surgery, doctor?
If a patient comes to me and is due for a major operation like radical prostatectomy, removing for cancer, then I try my best to link them up with another of my previous patient who underwent the operation, so that they get what we call peer-to-peer support, so that one patient talking to another person helps and supports the system. But it is not something we can put in the public forum. So whenever a patient comes and they need help, we will help them by connecting that patient with the previous patient, so that it is a mutual help that they achieve. But it is not it will not be appropriate to put it in a forum.
Thank you, doctor. It was a very interactive section, and so many viewers will get to know about the prostate and any doubts also they have clarified. And thank you for your valuable time and information.
Thank you so much to Apollo Hospitals, Apollo Spectra, and everything that has been arranged today. And thank you for nice questions. Really
Thank
appreciate that.